Falk. I'm with Dosher Physical Therapy, and we're going to do an instructional video with teaching the basic techniques for manual edema mobilization. And I have Kathy as my assistant, who's going to will be doing the demonstrations on, and we're going to say basically at this point that she has a pathology of the knee which is causing edema around the knee and perhaps into the lower leg. So we're going to work on clearing this edema using manual edema mobilization. To begin the techniques, we're going to start doing some trunk clearing, and that's important because we want to clear out the lymphatic duct, primarily in the abdominal region and as well as through the inguinal region, to allow this fluid to have somewhere to go. So what I'm going to have Kathy begin is doing some abdominal breathing using the diaphragm, and I'm going to have her place her hands, and as the therapist you can also place your hands over top of theirs to allow them to kind of feel some pressure. And Kathy, I'm going to have you just take some deep breaths, breathe into your hands, try to let your shoulders relax, breathe out through your mouth, very good. You're going to have the patient breathe in through the nose, fill, and then give a little pressure and squeeze. And when they get the feel for squeezing, helping with the hands, you can allow them to do that. A little pressure as you breathe out. You're going to have them do about 5 breaths, and then relax and breathe normal. Okay? And it's good to do this for about 2 to 3 repetitions, again, just to stimulate flow through the thoracic duct, and which will again allow lymphatic flow from the lower extremities to have somewhere to go to. All right, now the next thing we'll do is incorporate some exercises in the routine to allow muscular contraction, and again that also helps to contribute to the lymphatic flow. Now that we've cleared the diaphragm and the thoracic duct, I'm going to have her do some bridging exercises. So go ahead and again, you may want to tighten the abdominals like you do with the pelvic tilt as you bridge. This incorporates the abdominal muscles as well. Again, 10, 15 repetitions as the patient is comfortable. You don't want to have them do more than they're comfortable doing or anything that's going to cause pain. Okay. Very good. Now, with the exercises, as we'll see in the manual techniques, we also want to work from proximal to distal initially to allow for clearing of the areas that we're moving to begin with. So we start proximally with the abdominal breathing, moving down more distally, and then we'll work back up again to flow that fluid back once we've cleared the area where we're flowing to. So next we'll move down, let's straighten your right leg, do a straight leg raise. This will be moving down into the thigh, obviously working the rectus muscles and the quadriceps. And again, just 10 to 15 repetitions. And you may want to work both sides if time allows, or it is appropriate to do just the involved side, but ideally you would like to work bilaterally. Okay? Now, once we've done that, you could move down, and you can be creative with these exercises to work the quadriceps a bit more. You could do some terminal knee extensions with a ball or a coffee can under the knee. We'll go ahead and have Kathy do, to work the hamstrings to get the posterior thigh, do like a heel slide, or you can even do hamstring sets. That's it. Again, you can vary the repetitions and intensity according to the patient's particular needs. All right. So now that we've done the thigh, we can move down and do some ankle pumps, which will incorporate the anterior compartment as well as the posterior compartment for the gastrocnemius and soleus. Again, just working the ankle pump, facilitating the lymphatic return. Okay? Very good. Okay? And if you do have some edema into the toes, you can do some toe curls using a towel or a sheet if you have this, just scrunching the toes, or even working inversion, eversion at the ankle. You can be creative again with these exercises, just thinking proximal to distal for clearing, and then from distal to proximal for flowing. So now that we've gone out to distal, we can work back and repeat the same process working back. And this is a good way to, again, just stimulate the lymphatics by doing the exercises to begin with before you do your manual techniques. And oftentimes once the patients become independent with these things, you can have them working on these exercises prior to doing your manual edema mobilization, and they don't necessarily have to be supervised all the time once they become independent. and you incorporate that into your treatment regimen. All right, now we're going to move back, and we'll say that we've gone from proximal or distal to proximal with our exercises and repeated the same process, and we'll go ahead and begin our manual techniques. Now that we've done our clearing and flowing exercises for the lower extremities, we're going to start with our pump points. And there are some other techniques which you can do that will clear the lateral trunk, which your instructors may be able to share with you. That's if you have involvement up into the lumbar region or lateral thoracic region, and if you notice some edema in those areas, there are some clearing techniques which you can do there. With Kathy, we're going to assume that, again, her edema is in the lower leg, and that we will just work on beginning with the lumbar nodes and our pump points for the lower extremities, so we'll go through those now. The first pump point includes the lumbar nodes, which are right over the lumbar spine, and also the piriformis, which basically is a region where you have a lymphatic bundle, and we want to clear and flow the piriformis region so that all is going to be draining from the lower extremities. To begin with, over the lumbar region, you get right on the skin and basically come, again, right over top of the lumbar region, and you're just giving U's, which are right directly over the lumbar nodes. Simultaneously, you can come into the piriformis region and give clearing and flowing of the piriformis. So you want to start proximal, clear to distal, and then flow back proximal. So all the while stimulating the lumbar nodes. Okay? So we'll give just a little pressure here, and then we can begin clearing for the piriformis. Okay? And it's a real succinct and light touch. You can give a little more pressure over the node regions, over the lumbar, than you would over the other areas. Those nodes can be softened up a little bit more, but when you're dealing with the lymphatics, or lymphatic bundles, again, it's real light pressure, and you can give about 5 to 10 little U's just in that direction, okay? And then move distally to do your clearing. Okay? And once you've got that area cleared for the piriformis, you can come back and do your flowing. And that's 1 to 2 U's moving from distal to proximal. Okay, just like that. All right. Now we'll go on to pump point 2. The second pump point, we're going to incorporate the piriformis region as well as the lateral thigh region. Again, the same principles apply. We're not dealing with lymphatic nodes, so we're going to actually clear and flow just like we did the piriformis region, but we're going to also incorporate the lateral thigh. So we're going to start proximal, begin using our U's, again 5 to 2 U's. All right, and then move a little more distal. Again, work till you get all the regions covered. Okay? Once you've completed your clearing, you can move back using your flow, 1 to 2 U's. Okay? All this is in the direction of the lumbar nodes. This is where your lymphatic flow is headed in this region. Okay? Very good. Okay, we'll move on to pump point 3. Now, prior to doing pump point 3, we do want to go ahead and stimulate the inguinal nodes. They are part of the pump point, but we do want to loosen those up prior to moving fluid from the medial thigh region into that area. So it's a good idea after you finish pump point 2 to come to the inguinal node region, and you want to use your palm with the fingers pointed away from the groin region, laying right over top of the inguinal nodes. And it's just same motion as you used for the lumbar region, and again, maybe a little bit more pressure than you would over a lymphatic bundle or lymphatic vessel, but just to soften those inguinal nodes prior to doing our pump point 3. Okay, so again, probably 5 to 10 U-shaped motions directly just loosening over top of the inguinal region. Now, for pump point 3, we're going to do our same technique as we just did for the inguinal nodes, but we're going to incorporate the medial thigh bundle as well. And again, we want to work on clear and flow of this region, just like we did for the piriformis and lateral thigh, but we're also going to stimulate the inguinal nodes simultaneously. So inguinal nodes, as we did before, coming to the medial thigh bundle. And again, 5 to 10 U's. And your direction with the U's here, again, is towards the inguinal region, is where we're trying to flow at this time. Okay? And we'll move more distal as we're clearing. Very good. And then we can come back and we'll flow the medial thigh bundle area. Okay. And again, you can repeat this process. If you have edema around the knee, as we would say Kathy does, you may want to spend a little more time here than you did in the piriformis region or lateral thigh, where we didn't have as much or any edema at this time. So wherever you begin to have edema, you want to spend more time there. And you'll get the feel for tissue that has more fluid, has a little more thickening to it. You can tell that it's not quite as mobile as other tissue that's not edematous. Also, you may decide, if this is in a region that you have a good bit of edema, you may want to come back and do some stimulation of the quads, doing some more exercise, perhaps some quad sets or leg raises, even coming back and following up with diaphragmatic breathing. It's always a good idea to incorporate that and have your patient do those things while you can even still be doing some of your techniques. This will again help to facilitate the flow of the lymphatics coming into the thoracic duct and working through that region, so that it's going to help to facilitate everything flowing all throughout your techniques. Okay? So we'll move on to our pump point 4. Okay, prior to doing pump point 4, want to make sure we are going to take care of the thigh. One thing we need to do is clear and flow the anterior thigh and the posterior thigh. We'll do each region separately, and keeping in mind the lymphatic flow for the anterior thigh is going to move from lateral to medial, and by lateral I mean round more posterior towards the posterior thigh, more the anterior compartment, moving from lateral to medial and working again from proximal to distal, and then coming back from distal to proximal to clear and flow. So we'll demonstrate these techniques and then do the same for the posterior thigh, which actually drains more anteriorly, so that you're going to bring that fluid forward to then drain into the inguinal nodes. So begin with the anterior thigh. We're going to come just down below the inguinal nodes, and we'll start doing our clearing. Now ideally, you do want to have direct contact with the skin, so that you have good feel and good traction, because again, you don't want the skin to slide under your hands. You want to make sure that you're getting good movement of the tissues below the skin. Okay, so we're going to start at the anterior thigh proximally, move medial to lateral to clear, and then lateral to medial to flow. Okay, and again, your U's are in the direction of the inguinal nodes and anterior thigh. Okay, then we'll just move down the thigh again. We're going to clear, start medial, move to the lateral thigh. Okay, and bring it back to flow to the anterior thigh. Okay, and you would repeat this process down the thigh until you get to the distal and work back proximal to flow, what we just repeated. Okay. Now, for the posterior thigh, you may want to have the patient flex the knee. You can use pillows under the thigh or popliteal region if it's difficult for them to hold that leg in that position. But the same principles apply as the anterior thigh. We're going to start more medial, we're going to start lateral rather for the posterior thigh, so that we can do our clearing first. And again, the direction of flow here is more towards the anterior thigh, so we want to start our U's coming in the direction of the anterior thigh, move more medial, just below the gluteal cleft, so that you're getting all of the thigh incorporated, and then you can flow back towards the anterior thigh. Okay? All right. Then, once you've done that, you can move more distal, repeat the process for the other portion.